All right. Hi, everyone. This is Hamaya Kader, Director, Research Interest Group in Telemedicine. And I would like to welcome you all to the first episode of Meet the Match Alumni, presented by Research Interest Group Internal Medicine in collaboration with SoMR. Today, for our first episode, we have here with us Dr. Shajie Ur Rehman Usmani, who is also the founder of SoMR. And thank you so much, Dr. Shaji, for making it here to the podcast today. We really appreciate you taking out the time for us.
My pleasure. Happy to be here.
So, I would like to talk a bit about our guest here. Dr. Shaji is Dow's alumnus of class of 2023. He's also the advisory council member at DSS, SAYA, and SOMR. Also part of the board of directors member at SOCH, chair of Incision Pakistan. He matched in this year in 2026 at UT Southwestern Medical Center in Dallas, Texas, in general surgery prelim. Congratulations, Dr. Shajie. This is really a proud moment, especially for all of us students who look up to you. And you're definitely a big source of inspiration for all of us.
Thank you so much. Allah has been too kind, and so the credit goes to my family and my support system. So yeah.
Mm-hmm. All right. So starting off the podcast officially, I would like to ask you more about your journey. So to begin, could you tell us about your journey from medical school at Dow to matching into general surgery this year, and how has the overall journey been like for you?
All right. So before I dive into the specifics of this question, I think it's important to give a bit of perspective. I've always wanted to do medicine. Like since my high school, I was very involved in extracurriculars when it came to volunteering at hospitals and stuff. I was part of the Community Service Society back in Beacon House where I did my A-levels. And then I remember that before my MD-CAT, I got a severe case of hepatitis E. And that was 2 months before my MD-CAT. And I was in the hospital for 2 to 3 weeks, and it was so bad. My INR was 5.7, I think. If you're a medical student, you can understand how bad that is. And my doctor said that I was about to bleed out. So it was a humbling experience because when I got discharged, I think my MD-CAT was in like 10 or 12 days or something. And I remember on the test day, I still had yellowing of the eyes. I was very weak. And you जो आपको पता है NED में हमारा टेस्ट सेंटर था उस वक्त तो it's so many people and it's so hot and I was about to pass out as well. And I just gave it because I couldn't study properly either because of the illness. And when I got my result, I was actually laughing because I didn't expect that result at all. And my mom was also laughing with me. I mean, in happiness, out of happiness, of course, but we couldn't believe our eyes. So in that moment, I think I told myself that Shaji, this was not you. I mean, this was Allah, obviously, and He did this because He wanted you to go to Tao, and He wanted you to go through the journey that you're about to go through, right? So that was one of the most humbling experiences in my life, and I think that's when I really started to ground myself and look at things from a very different perspective. So as soon as I started DAO, I was very active in volunteer activities. I started out at SOCH as Deputy Director of Operations. In my second year, I was promoted to Vice President directly because Saror Siddiqui, who became the President, saw something in me and he promoted me directly to Vice President without becoming a director. And then I started joining other societies, VFOD, IFMSA. Then I was the founding General Secretary of SAYA. And of course, other organizations that came along the way. I founded SoMR alongside Saror Siddiqui, who was one of the most important people in my life, and he's a great mentor. And without him, I wouldn't be here. So he and I started SoMR because we wanted to fill a huge gap, in the research scene at Dow. Because we could obviously see that only those who could afford, expensive workshops could take research workshops, and there was a huge portion of the student body who wasn't able to, take any research workshop, and they were, lacking just because they couldn't afford them. I was like, Shajie, you have to do something about it. And this was fourth year, by the way, when I was starting doing research myself. Um, I went to Sarosh. I was like, let's do something about this because I was struggling. I had so many connections and I was struggling to do research with people. So I was like, how must other people be feeling? So he and I started something, and it has been slow. It has been gradual because our society has a vision that is very different from other research societies. We believe in universal access to research learning, and I think that took a lot of effort because research, unfortunately, most people get into research to get something out of it, but that's not how I see research. Research, I think, is a very, very noble venture. You go into research because you actually want to make an impact, and that's how it should be. ये ऐसी बात हो गई कि मैं कहीं volunteer work करने जा रहा हूँ और मैं सिर्फ certificate के लिए जा रहा हूँ. I think that's very unfair to the activity itself, to the deed itself. And I'm just fooling myself कि मैं मतलब दूसरों को अच्छा लगने के लिए दूसरे देखें कि बोलते हैं शजी भाई माशाल्लाह कितनी volunteer activities करते हैं और लेकिन अंदर मेरे दिल में हो कि I'm only doing it because I want recognition or I want something out of it. I think that is the worst possible mindset that you can have when it comes to extracurriculars and research. Unfortunately, that is so prevalent. So I came out to change this. And SoMR was, sort of a slap in the face of those who believed otherwise. And, it has been a long journey and we have, so much more to do, inshallah. And I believe in the capability of SoMR and the people leading it, such as yourself, of course. And I hope to, really see it going to great heights and making the impact that we actually set out to make. Because things panned out, Dow ended, and I think I'll leave the rest of it because, of course, you'll ask questions pertaining to it. But I think this was my journey, and it was mostly just extracurriculars, and I made amazing friends throughout and knew amazing people because Dow is full of brilliant people, very so much potential. They just need to learn how to use it the right way. And I think that's where we lack. That's where we need to work as seniors to guide our juniors to think better, to frame our mindset in a way that we see things in a broader light and we see the big picture rather than just, thinking about what we're getting out of it and where we'll be in 1 or 2 years. I think that's a very short-sighted way of looking at things.
That's honestly really inspiring to hear, especially your MCAT story and everything. And it just shows your resilience throughout the whole process. And we really owe it to you guys. You guys are great mentors, honestly. And we hope to continue the legacy ahead. I'm obviously not as good as you guys, but, we wish to make an impact.
Inshallah, you guys will be better.
Also, moving forward, I would like to ask you another question. So, at one point, did you feel like general surgery was the specialty for you?
So, I think I've always known that I wanted to be a surgeon because I was always a very hands-on kind of guy. I've been into sports since I was a child. I like making things happen. I don't have that much patience. So, when I see something wrong, I want to do something about it. And SoMR is an example of that. So I think surgeons excel in that particular field because when they see something wrong, they're desperate to do something about it, and they're able to do something about it. And there was this one experience back in high school when I was volunteering at NICH. You guys must know the National Institute of Child Health, which is Jinnah's Children's Hospital. And there was this very life-altering experience there that pushed me towards medicine. And because the experience was pediatric related, I always wanted to do something for the kids because, growing up in Pakistan, we've seen discrepancies and we've seen injustice when it comes to equal access to healthcare, and children suffer most. And even when we look at global statistics, children are a huge proportion of the people who suffer, especially in war zones in Gaza and other areas. So when I decided to be a surgeon, of course, when I was coming from that mindset, surgery and pediatrics naturally matches into pediatric surgery, and that's something that I want to do eventually. Um, and I think that is it. And when I got experience to surgery in my clerkship rotations, and then when I went into observerships in the US, I think that really cemented my passion towards surgery and global surgery as well. Global surgery is a concept that I will talk about later on, but I think it's one of the key motivators that I have to pursue surgery.
Thank you for sharing your 2 cents over this. This is definitely a very unique experience, and we would love to hear more about it. Moving forward, I would also like to ask you a follow-up question. So, generally, around general surgery, there's a big stigma, especially among the IMGs, that it's really hard to get into. You need a lot of publications. It's impossible and stuff. So, what made you pursue this whole pathway and this specialty regardless? And were there ever instances where you felt like giving up, or were you ever did you ever consider another specialty along the way? We would love to hear about this.
Um, so the thing is, I never thought of another specialty because I couldn't imagine my life doing anything else. Medicine never really made any sense. It was no offense to you guys, of course, you guys the internal medicine and recently just from, but medicine never made any sense. It was, I think, too boring for someone like me. It was not happening enough. So surgery made perfect sense. The only thing that I got confused about was the pathway I had to take to pursue surgery. So in fourth year, I remember when I started doing research, I started doing research because I wanted to pursue the USMLE. Everyone was like pressuring me into it. You know, the USMLE में research के बगैर नहीं होगा, and so you need to start doing it. I always knew it at the back of my mind कि करनी होगी eventually. But when I started doing it, मैंने अपना mindset इसे बना लिया था अपने आप को convince करने के लिए कि Shajie, you're not doing it for USMLE, you're doing it for the purpose that you believe in, and anything else that comes out of it is just what you were destined to get. So I started doing research in that with that mindset, and then I reached out to the surgeon in the US. He was doing, I think, cardiac surgery fellowship in the US at that time, and he motivated me a lot. I was like, I won't mention his name, but I was like, hey, doctor, I'm very confused about pursuing surgery in the US because I wanted to go to the US, but I was so confused. Like you guys said, there's a huge stigma, and I was scared. So it was like, Shajie, I got here. There's so many other people who got here. There's someone, there's Dr. Hassan Alam. He's the chair of surgery at Northwestern University in Chicago. He is a Pakistani. So many amazing Pakistani surgeons. Dr. Salim Islam, the chair of surgery at AKU. He was a pediatric surgeon in the US. So there are so many great examples. So if you really want to do it, you can do it, but you will need to have a certain kind of mindset. So it requires a lot of extra work. It requires you going outside the comfort zone and doing things even when you don't want to, when you don't have the motivation, and just being persistent and annoying when it comes to achieving all your goals. So that's how I started out, and Alhamdulillah, I've been able to do a lot more than I ever expected to do, but there's just so much more to do. So बस यही mindset I think change करना होगा. Anything is possible, and IMGs match in surgery every year in the US. Not as many as medicine or other specialties, but of course people match. So if people are matching, it means that there is a possibility. You just have to make sure that you give the effort that it actually requires. You can't not put in 100% and then cry about not getting in, right? You have to put in your 100% and then you can expect something out of it. Right? Otherwise, you're just being unfair to people who are actually working really, really hard to deserve that spot. So make up that mindset. Decide to do it, and then just do it. Start right now. अपनी CV उस तरफ orient करें, उस पे भी बात करेंगे, and just focus wholeheartedly on surgery, and inshallah you'll get in if you do things the right way.
Thank you so much for sharing your thoughts. That was really inspiring. Even us as internal medicine people right now, it's inspiring us to go into surgery, legit. So moving forward, I would like to now move on to the application side of things. So you mentioned, and all of us know as well, that you're pursuing the USMLE pathway, right? So for our viewers and people watching, could you please guide us about the application side of things, such as what components of the application matter most for the students, and what should they actually focus on?
I think for surgery, I will be very precise. You need a step two score of 250 plus, right? That doesn't mean that if you get below 250, you won't get in. I'm just saying what the requirement is, what most people say that you need to get. That's what I heard as well, and that's what most people hear. That you should aim for 250 plus, the higher the better, of course. Secondly, connections. I think connections play the biggest role in you matching. So if we compare general surgery to, for example, internal medicine or family medicine, there are so many programs in the US for internal medicine, family medicine that Americans do not even think about going to, right? So there's always a gap for IMGs to fill, right? And that is why IMGs are able to match relatively easily into these specialties and other specialties such as pediatrics, for example, neurology or psychiatry, because there's a huge gap. There's just so many spots, right? But for surgery, because there are limited spots, surgery can only be practiced in a certain kind of hospital. You cannot do it in a clinic. You cannot do it in a small setting, right? Surgery needs to happen at a relatively bigger place. And for a residency program to function, it needs to have a certain kind of patient look, right? It needs to have a certain kind of expertise and equipment. So there are relatively much fewer spots for surgery. And because it is such an attractive field, Americans jump at the opportunity of going into surgery, right? So you're competing with the most hardworking American medical students for surgery, right? So which is why it's much harder for us to get in, and that is a reality, right? So connections play the biggest role. You won't get as many interviews as IM or FM or PEDS in surgery. The best chance you have at getting an interview is when you do a rotation at that program, right? So when you actually go to the program, you get to know people, and then you request them to recommend you and give you a letter. That's when you actually have a chance of getting an interview. And the more interviews you have, the better chance you have. So, for example, if you do 3 observerships, right, and you do all of them at an IMG friendly program, then you have the best chance of getting interviews at those programs, right? Observerships के अलावा interviews आना are very, very hard in surgery because, see, when you're comparing Pak's IMGs with very hardworking American graduates, you need objective ways of comparing applications, right? So there was this high-level meeting in American College of Surgery a year or two ago, and there were program directors sitting there for general surgery, and someone asked one of the program directors, what is the main barrier that IMGs face in getting interviews? And they were like, we need an objective lens to view them through, right? And the only thing that we can count on is the US clinical experience, because we don't have any other way of seeing if this applicant is competent, right? Observerships do not cut that. Observerships are just shadowing, observing, learning, engaging, that's it. But when you actually go on electives, you can do hands-on, and when you get that letter, that holds immense value. But since most people are unable to do 3 months or 6 months or 1 year of electives, we don't get as many interviews because they need to sign us up for 5 year commitments, right? General surgery is minimum 5 years. They cannot just do that out of the blue. So that's why they prefer Americans, right? So connections यहाँ पे बहुत बड़ा रोल प्ले करते हैं. आपको बेशक वो आपको hands on नहीं assess कर पा रहे, but they still know you and they can recommend you, and then you can match into a prelim spot and then maybe prove yourself in your prelim spot and then hope to match into categorical. So connections, yes. Number two, very, very important. Apart from the step twos, for connections are the most important thing, and you should start working on them right now. उस पे भी elaborate करूँगा बाद में किस तरह कर सकता हूँ. Number three is research. Research पे भी बात करेंगे बाद में. Research is very important. Publications and presentations both, right? And then you have your, extracurriculars and stuff like that, but they don't really get you an interview as such. They just make you interesting for the interview. Right, so do not expect anything to come out of your extracurriculars. Alhamdulillah, I had amazing extracurriculars, but they didn't land me an interview, unfortunately, and that's how I learned it the hard way. That you need unique connections and amazing step two scores, and if you have them, you have a chance of getting prelim interviews.
That makes a lot of sense. Thank you for clearing that up. I also had a follow-up question. So you mentioned about the importance of the US clinical experience and research and everything. What about medical school grades and transcripts? Are they important in terms of the match and everything?
So if you look at statistics, I don't remember exactly the weightage they had, but they do have a weightage, of course. But I think it's a very small portion of that, the entire application. So if you do not have subpar GPA or, like very, very bad scores, I think you're good. I don't think they decide to give you an interview based on just your GPA. It might be just a bonus to some program directors that you have, for example, 3.8 or 4. I had like 3.6 CGPA, and I think that was fine. That really mattered. Nobody asked about it. I don't think anybody cares about it that much. They just care more about your step two score and your connections. And I think that's what really convinces them that that you've got what it takes.
Hmm. That makes sense. Thank you for sharing information, your opinion on it. So now moving forward, I had another question. So if you had the chance to rebuild your whole CV from first year, is there anything you'd like to do differently? And could you also talk about some of the common mistakes that people make while preparing for the match in general surgery or the match in general?
All right, so that's a good question. So I think if I had to, uh, give some recommendations to my juniors, uh, so I think firstly, I think it's very important to start doing research early on. And when I say research, I just don't mean the research that we do at Dow. I think it's a very toxic culture that we just, start from a meta-analysis and then we end at a CDC study. I think that's not how it's supposed to go. Uh, when I say start research early on, I mean start learning research ethically early on. How to do research, the basics of research, how to write, how to publish at least the basic kinds of articles. You should know. I mean, it's weird that people know how to publish a meta-analysis, but not how to publish a letter to the editor or review. So start from there. That builds your writing skills, that builds your communication and leadership skills, and your basic research skills, and then you move on to analysis, and then you start doing systematic reviews and meta-analysis and stuff. Uh, but start early on, start in first year, because in first and second year, I think you have a lot of time to give to extracurriculars. Research should definitely be a priority. And I would like to add the ethical portion to this answer because research बहुत unethically हो रही होती है around us. People just do anything for an authorship, and some people exploit others for authorship. And I think that's not how it should happen. Basic ethics, seeking research skill, because when the ultimate aim, if you are pursuing the U.S. Assembly pathway, is to connect with attendings in the United States to do research with them, and that eventually builds your connection, right? So अगर आप ethical research नहीं सीखेंगे, they will catch you in the act, right? Because they will question you कि ये ऐसे कैसे हो गया? How did this happen? How did you do this? And it will catch up to you eventually, even if they don't catch you in the act. So basics strong करें, and then learn as many types of research as possible. And then in third and fourth year, I think start reaching out to attendings in the United States and start collaborating with them. Invite them to be a senior author on your project and lead that project to publication in the most effective and punctual way. And that's how you will gain their trust. And when you have their trust me, they will help you beyond your expectations, right? It's not like people do not want to help. There are just so many people who want to help. They just want to help someone who actually deserves the help. So if you just send a blind cold email to someone in the US requesting them for an observership, as most people do, and they get, they don't get a response, then they get disappointed. But I think that's very unfair to expect from someone who doesn't even know you, right? So offer them something before you request them for something. When you give them a publication, they're bound to help you. And that's what I did. I started collaborating with surgeons in the US. And once I had that connection, I requested observerships, I requested further collaborations. Alhamdulillah, that landed me a lot of connections. Very, very important connections, even if not for general surgery, but for my pediatric surgery aspirations. And I'm all set, connected to some of the best pediatric surgeons in the US. And I hope to leverage that, inshallah, during my journey once I prepare for the fellowship match. So research gets you to amazing places. So अब भी से focus करेंगे, priority देंगे, तो it will land you brilliant connections that you can leverage for observerships, electives, and other things. Research fellowships, for example. And secondly, I think what I would do is I even touched upon this. Do observerships slash selectives at IMG friendly hospitals. That is very, very important for general surgery. Medicine, may you can get away with it. You can get interviews even from places you get never rotated at. But in surgery, the chances are relatively much lesser. So when you're spending so much money to go somewhere where you actually have an IMG friendly residency program for general surgery. And how do you go there? You build connections relevant to that opportunity. So you do research with attendings in that program, right? Instead of just collaborating with anyone, anywhere, you build a strategy and you follow it. And I think that will land you at amazing places and give you amazing opportunities.
That makes a lot of sense. Thank you for sharing your advice over this. I had one last question. So, could you talk about, or could you tell us one underrated thing that helped you match, and also talk about one overrated thing that applicants do worry too much about?
Mhm. I don't think there's anything that stands out as underrated or overrated. I think it was very much as expected. Like I said, I had amazing extracurriculars, and some of my seniors who are actually doing surgery residence in the US were very motivating towards me. Shajie, you will get interviews, trust me, you will get in. And I got confident. But then when I didn't get as many interviews as I expected, I started to realize what I always knew, that connections mattered the most. Right. So I won't say that that's underrated or overrated. Obviously, everyone knows and everyone talks about that connections matter a lot, and they actually do. So when it hit me, it hit me. I was like, Shajie, you should have done something differently. But then again, I don't think like that. So whenever I start thinking like that, I shut myself down and I start thinking about things differently. And I learned to be grateful for the interviews that I did get and alhamdulillah match. So things happen sometimes not the way that you want them to, but they eventually work out in the best possible way for you. Um, so yeah, I think it's very important to have a very well balanced CV. So just when bola step two score research, connections, extracurriculars, हर चीज को साथ साथ build करें and be consistent in your endeavors. ठीक है, आपने दो रिसर्च की एक साल, फिर आपने 2 साल का गैप ले लिया, आपने एक ऑर्गेनाइजेशन में वॉलंटियर किया, फिर 2 साल का, 1 साल का, 6 महीने का गैप ले लिया, देन यू स्टार्टेड एज एन एसोसिएट इन अ डिफरेंट सोसाइटी, वहां पे आपने एसोसिएट का काम पूरा किया, पर आपने वहां पे छोड़ दिया. So that is a very haphazard CV. People will find it hard to trust you, right? You need to show that you're consistent and persistent in your endeavors, and that you have goals when it comes to your endeavors, and that you're doing something for a reason, right? Just when I started Soch, I continued in Soch. I left as the board of directors, right? I became president, then I became board of directors. As SoMR, when I started, I'm still affiliated with it. Research मैंने fourth year में start की, जब से मैंने नहीं छोड़ी. Anything I started doing, मैं अपने आप को पहले से convince कर लेता, Shaji, this is why you're doing it. Stick to that intention, and that intention was much superior to any sort of motivation that I could give myself. कि शाजी तुम्हें CV तुम्हारी CV अच्छी हो जाएगी, तुम्हारा ये हो जाएगा, वो हो जाएगा. I think doing things for the sole purpose of why they're done, essentially. For example, जैसे मैंने research की बात की, it's a noble endeavor, उसी तरह करें, उसी नियत से करेंगे, आप बहुत आगे तक करते रहेंगे, even if you don't want to do it. Extracurriculars, volunteer work, मैंने ऐसे ही किया. Never stopped, never wanted to stop, and that's what I kept doing. So yeah, I think it's very important to be consistent and have a balanced CV. I think that matters more than anything.
That's really inspiring to hear, and I definitely agree with your perspective on the motivation part. Because if there's no motive in doing stuff, then obviously there will be hindrance at one point. So I definitely agree with you. And that was the last question from my side. Now over to my associate Jazla, who will be continuing the next section of the podcast.
Hello, am I audible?
Yes.
Yeah, you are.
So, Dr. Shajie, you have mentioned a lot about research and the importance of research that there is in order to match effectively and also to build your CV and to build connections as well. So you yourself have 30 plus publications, more than 100 citations, are a co-founder of SoMR and have multiple accomplishments across research, advocacy, and service, which all has helped you build a successful journey for yourself. What would you say has been the main driving force behind it all?
Right. So I think that's a very good question. I touched upon this earlier as well. Research is something that is very special to me, even though I don't enjoy doing it. Now, that's a very weird statement. I bet you've never heard something of that sort. Someone doing things that they're not fond of doing it, but they're still very passionate about it. That's me. Why am I passionate about research? Like I said, I do it because of why it should be done, right? So anything else doesn't matter, right? When my perspective got shaped by that experience that I talked about early on, I think I became very grounded when it comes to giving back to my community, to the people who have been there for me, and in that regard, I think research also वो mindset research में भी आया है कि दूसरों के लिए कर रहा हूँ एंड जब भी मैं कोई रिसर्च सबमिट कर रहा होता हूँ ना फॉर एग्जांपल इन द जर्नल और समवेयर तो मैं एक्टिवली नियत करता हूँ जैसे आप नमाज से पहले नियत करते हैं ठीक है कि आप किस लिए कर रहे हैं मैं तो मैं करता हूँ अल्लाह मैं ये रिसर्च आपकी इंसानियत की खिदमत के लिए कर रहा हूँ इसको एक्सेप्ट कर दीजिए इसको पब्लिश करा दें जो भी आपको दुआ मांगते हैं that's when I click the submit button because in that second no matter what my secondary motivations are I convince myself कि मेरी primary motivation यही है why I'm doing research और इसलिए I'm passionate about doing research I don't enjoy doing it मैं बैठ के लिटरेचर सर्च करना डेटा एक्सट्रैक्शन करना जो भी काम होते हैं रिसर्च में मुझे बिल्कुल मजा नहीं आता ठीक है लेकिन I keep doing them because the, the the motivator that I have is much bigger than any personal motive that I could have इसी तरह फिर जाहिर है एसओएमआर का भी मैंने आपको बताया कि नोटिस्ड अ गैप आई एम अ डूअर आई वांट टू फिक्स थिंग्स ठीक है एंड आई वेंट टू द बेस्ट fixer that I had in mind, Saroj Siddiqui, and we both tried to fix things and we started SOMR. So I think that's why you should do research. And if you believe in uh, service to other people, if you believe in divinity, if you believe in heaven, God, whatever you believe in, then I think this should be your motivation, nothing else. And inshallah, things will fall into your lap if you do it with that intention. बाकी तो जाहिर है अगर आप malicious या किसी second intention से करेंगे तो फिर at some point you will lose that motivation. You will stop doing it. You will get discouraged. You will lose hope or something. But it won't stop someone like me who has that intention and कोई भी barrier hurdle आता है. People know me as the most persistent researcher. 2-2.5 साल बाद मैंने publications की हैं बिकॉज मैं लगा रहता हूँ टीम की मोटिवेशन चली जाती है मैं खुद सबमिट करने पे आ जाता हूँ मैं सबमिट करता रहता हूँ कभी कभी 15 जर्नल्स मैंने सबमिट किया और फिर उसमें एक्सेप्टेंस आई है सो इट्स more about persistence and having that sort of mindset.
Yeah, I definitely agree with you on that. Both intention and motivation uh, really help to publish effective research. So, moving on to the next question, how would you say you approach research strategically from early on, and what strategies help you remain consistent while balancing academics and other commitments as well?
Actually, I don't think managing things in Dow especially is that hard. I mean, yes, it is hard. It's medical school. But I think if you want to do something, you can do it. Dow is one of those colleges that gives you the flexibility you need, unlike some other private institutions that, make you do a lot of hard work. But even in those places, people do what they want to do. People do a lot of research and stuff. So I think just prioritize research. When you prioritize something, you will do it. The strategy AT, since I started out in fourth year, I had much lesser time than most of most of the other people that were on the same journey as me. So I had to capitalize on what time I had left, and I started with the letter to the editor, and then I moved on to reviews and meta analysis very quickly. So I didn't take my sweet time because I didn't have it, and I started publishing with surgeons in the US after I graduated. And the key is, I think, something that my senior told me, Shajie, you need to start leading your own initiatives. Because ज़ाहिर है जब आप किसी project का part बनते हैं, you're dependent on the team, right? You have no say in how it goes, or very little say, and it's just one project that you're working on. But once you start leading, and you don't need to know everything about the project to lead, right? आपको क्या लगता है कि फॉर एग्जांपल डॉक्टर बारी की मैं एग्जांपल सबको देता हूँ, डॉक्टर अब्दुल बारी द चेयरमैन ऑफ इंडस हेल्थ नेटवर्क, उन्होंने खुद अपने मुंह से बोला था कि मुझे हर चीज नहीं आती थी कि हॉस्पिटल कैसे चलाया जाता है, लेकिन मैंने उन लोगों को हायर किया जिनको वो चीजें आती थी. ठीक है, तो व्हेन यू लीड द प्रोजेक्ट you recruit people who know how to do that specific kind of work. For example, analysis मेरी weak थी, मैंने कभी बहुत ज्यादा टाइम नहीं लगाया, ना मैंने सही से सीखी, because I had, like I said, I had lesser time. So I used to recruit people who, and still do, who are good at analysis, जो करके दे सकते हैं आराम से, right? So इसी तरह I started leading multiple projects at once, and I think that really helped me increase the volume of publications that I could get in the time I had left. And it was still a slow process because publications take time. And surgery में खास तौर पे और मुश्किल होता है because there are so, I mean, much fewer people doing research in surgery. So you need to find the right people, and sometimes you find the wrong kind of people who are not motivated and they slow down your projects. I think that happens to everyone. But yeah, I think 30 publications ho gayi, I don't know. But it's been a long journey still, and I felt I have a lot more to do. And I eventually want to go into clinical research. So that's, I think, when I will actually start enjoying research. बाकी strategy aim है जैसे मैंने बोला है, and I think just have that kind of mindset and make goals for yourself for 6 months, 1 year. कितनी publications aim करनी है, कितने projects aim करने हैं, and just start leading your own initiatives, make your own team, help them come up with a topic and start reaching out to attendings in the US with that topic, and request them to be a senior author and just get to it.
Thank you so much, Dr. Shajie. That was some really good advice, because I obviously agree, when you're leading your own project, you can take things at your own pace, and basically you're like managing everything. So you get to that aspect as well. And you just can move things with your own pace. So moving on to my next question. You mentioned that you have around 30 publications up to now, mashallah. So how many publications or projects do you think are competitive for surgery? And is there like a specific number you say that students should aim for?
That's a good question. I think a year or two ago, I saw NRMP statistics on the matched applicants in surgery. And general surgery applicants had an average of, I think, 8 to 10 or 10 to 12 publications and around 5 presentations. And most of those applicants are American graduates, so you're not even at the same level, right? So I think as an IMG, you should aim for at least 15. Again, अगर उससे कम होए तो मैं ये नहीं कह रहा आपका मैच नहीं हो सकता, but I think if you have the time and the resources and the willpower to pursue surgery, then I think you should aim for what is expected. So at least aim for 15 publications and try to get presentations. तो आप कर ही लेते हैं पाकिस्तान में बैठे बैठे, बहुत conferences में आप present कर सकते हैं, but aim for at least 1 or 2 US conferences to present at. Like I presented an oral presentation at the American College of Surgeons conference in Chicago last year, and then I had 2 oral presentations at the American Heart Association conference last year. So मैंने अपना जो US का trip था, I was there for 6 months, which is a very long time. But I was able to do a lot of things because मैंने planning उस हिसाब से की थी, and I could incorporate both conferences into my schedule. And alhamdulillah, that उससे पहले से जब आपको presentation चाहिए तो आपको उस हिसाब से project पे काम करना होता है, and you need to ensure that it's up to a certain standard, and then you have to submit it and hope for it to get accepted and then actually present it. So there's a lot of hard work that goes into it, especially for US conferences. So 1-1.5 साल पहले से आप सोचें कि इस conference को aim करना है, and team इकट्ठी करें and start at least doing 2 or 3 projects, ताकि अगर सारे accept ना हो, एक तो हों, chances बढ़ाएं अपने, right? एक अगर accept भी हो जाए तो you can go and present it, and you don't need to go अलग से, just whenever you're going for observers and electives, देखें उस दौरान कौन सी conferences आ रही हैं and aim for that conference. So I think planning is very important, and strategizing accordingly will help you.
Yeah, thank you so much. So Moving on to my next question. You mentioned that starting research early is great so that you can learn the basics first and then move on to more advanced type of research. So, how do you suggest students in earlier years start building a meaningful and competitive profile for research? And also, a lot of people in Pakistan, especially, uh, outside of DAO as well, have very limited opportunities at their home institution. So, how can IMG students compensate for these limited opportunities at their home institute?
Right. So I think that's a very good question. At Dow, we don't really have a problem with that. But yes, for other colleges, I think it's relatively harder to find the right motivation and the right kind of people. But I will give my example. मेरी पहली publication was a letter to the editor during COVID. उस वक्त एप्सिलॉन वेरिएंट आपको याद होगा नया नया आया था उस वक्त and I gathered two of my friends who didn't have a publication either, and we just wrote a letter to the editor. We submitted it, and it got accepted in the I think second or third journal that we aimed for. That's how I started. It was my own initiative, and I led it, and it happened. राइट और मेरी कोई खास मतलब वो नॉलेज नहीं थी ना मैंने कोई ज्यादा स्किल सीखी नहीं थी आई जस्ट टुक वन और टू रैंडम वर्कशॉप्स लेकिन वर्कशॉप्स तो आती जाती रहती हैं सोशल मीडिया पे एवरीवन हैज सोशल मीडिया वी कैन टेक ऑनलाइन वर्कशॉप देयर सो मेनी ऑर्गेनाइजेशंस कंडक्टिंग देम आई मीन दाओ में ही आई थिंक देयर आर 4 or 5 and then like nationally I think there's several others a lot of medical colleges have their own societies doing workshops. So I think basics आप सीख ही लेते हैं कम से कम writing किस तरह करनी है लेट्स डू द editor review are very basic types of research जिसमें आपको ज़्यादा skills नहीं चाहिए होते. You just need basic writing and literature research and a lot of the other basic skills. So I think you can put them into action and then take your own initiative. I think most people suffer because they wait for the opportunity to come to them. I think that is not ideal. Make your own opportunities make it happen for yourself and for an aspiring surgeon. I think that's even more important. अगर आप comparative specialty में aim कर रहे हैं, you will have to have that aptitude and mentality कि आपको चीजें खुद करनी पड़ेंगी. You will have to take the lead. You will have to take responsibility for your own journey instead of other people helping you and pulling your finger. कि आप उस तरफ चलें तो हम आपका काम होगा ऐसा नहीं हो सकता. वही बात है everything comes back to mindset. माइंडसेट अपना ऐसा बनाए कि अपने लिए कुछ चीजें करनी है स्टार्ट स्मॉल कोई एक दो रैंडम वर्कशॉप ले लें अगर आपको ज्यादा महंगी नहीं लेनी तो सस्ती वर्कशॉप ले लें इट्स फाइन बेसिक सीख लें एंड देन स्टार्ट मेकिंग थिंग्स हैपन फॉर योरसेल्फ इवेंचुअली इंशाल्लाह यू सी योरसेल्फ प्रोग्रेसिंग आप ज्यादा से ज्यादा लोगों से कनेक्ट होना शुरू हो जाएंगे बिकॉज यू स्टार्ट स्मॉल इवेंचुअली बिल्ड अ कम्युनिटी you start getting to know people who do research and then you work with them to pull in more projects and eventually more publications. So that's how you grow. I think that's a natural timeline. Just need to give yourself some time and space to grow. इसलिए early on start करना भी बहुत important है जैसा मैंने बोला you will have more time. You won't feel the pressure to do a lot of things in a very small amount of time, and you will learn research how it's supposed to be learned. And yeah, I think that is the most productive way of doing it.
Yeah, I definitely agree with you on this. Like putting yourself out and being willing to work is what gets you started in your research journey. So you also mentioned about the importance of extracurricular activities and how that shape yourself, both yourself as a person and also add a bonus point to your CV. So you're the co-founder at SoMR and which has had its meaningful impact on students both across DAO and even different other different medical colleges across Karachi. What would you say was the main motivation or inspiration for you to build this society?
I think I've talked about this before, but I will just summarize it. I saw a gap and I filled it that I wanted to make sure कि research सबके लिए accessible हो, सब सीख सकें और सब mentorship हासिल कर सकें. Obviously, it's a slow process and SYMR still has a long way to go to ensure that happens. But जाहिर है वही अभी तक हमारा goal है. इसलिए we're slow and steady, but we're getting there. तो वही है making something happen for other people, helping other people out, and making sure that we're all in this together and we're helping each other out instead of the toxic culture that gets built up, especially at DAO, where so many competitive people are just constantly, competing with each other and putting them down. I think that's a very unfortunate reality for a competitive institution. Um, and I had my own friends, exploiting me or taking advantage of me, or not giving me the respect I deserve. But I think that happens. It's like, but I just wanted to make sure कि दूसरे कम से कम suffer ना करें उस चीज से जो मैं कर रहा था. And Sarosh shared the same viewpoint and he made it happen. बाकी भी एक्स्ट्रा करिकुलर्स के लिए हमेशा यही माइंडसेट रहा है. And alhamdulillah, that mindset and that persistence brought me to some very very amazing places around the world as well. And but अगर मैं एप्लीकेशन के हवाले से बात करूँ, एक्स्ट्रा करिकुलर्स की इतनी वेटेज नहीं होती unfortunately. um, some program directors might value something, some might not. It's a very subjective sort of thing. So do not expect anything concrete out of it. Do not expect your extracurriculars to land you an interview. और इसलिए मैं कह रहा हूँ कि एक्स्ट्रा करिकुलर्स उसी नियत से करें जिससे की जाती है, because I think that is the only reason we do it, and that is the only reason you should keep doing it. It helps you become into a person you want to be, and people get to know that. जब आप रेजिडेंसी में स्टार्ट करेंगे, फॉर एग्जांपल आई एम स्टार्टिंग माय प्रीलिम ईयर, पीपल विल एक्चुअली गेट टू नो मी and they will recommend me for a categorical position if they know me to be a kind guy, nice guy, someone who helps other people, someone who's there. तो ज़ाहिर है ये traits ऐसे build up नहीं होते, right? अगर आप पहले से उस compassionate mindset से आ रहे हैं, उस helpful mindset से आ रहे हैं, of course you will be like that in your residency as well. So I think these soft skills and traits really help you excel when you're actually inside the system. Interview they make you interesting. People ask you good questions, and they get inspired by it. They get excited about it. But when you actually start, I think that's when these skills will actually help you to be a good resident, to stand out from the crowd, to excel. So I think have that expectation from ECS and just keep doing them. Keep doing what you love to do. Don't fall into peer pressure, and be persistent in your endeavors. I will repeat that again.
Thank you so much, Dr. Siddhi. That was some really nice advice. I'll just follow it up with a similar question. How would you say the like extracurricular activities, and particularly the founding of SoMR, shaped your medical school journey?
I think didn't really shape my medical school journey as such. I think they're just part of the entire experience, and I'm very very grateful to all the experiences that I've had. They've made me the person I've become. So I think उसका बस इसमें बहुत बड़ा हाथ रहा है कि मैं किस तरह चीजों को व्यू करता हूँ, and how I perceive life in general, and how I perceive myself to live life, and how to excel in certain domains of my life. And I think it has really helped me become more humble, I guess, because see, when you start achieving things, even in medical school, there's a natural sort of attitude that comes with it, right? You start to become that sort of person that you don't want to be, and I've seen that in a lot of people. They start boasting and they start showing off, and कुछ कर लिया, volunteer activity कर ली, तो social media पे सबको पता है कि उन्होंने कर ली. So I think the mixture of experiences that really helped me to become humble and realize the importance of these activities. And I think that's how it shaped my journey. I think it shaped my mindset and my personality. And inshallah, I hope to continue doing the same even in the United States in my own capacity. And hopefully other people will follow suit and continue doing things with the intention that these things deserve.
Yeah, I definitely agree with you on that topic, Shajie. So that was the last question from my side. I would now like to hand over to my co-associate Abia. Over to you.
Assalamualaikum, am I audible?
Walaikum assalam, yes.
All right, so I'll start with my questions talking about international experiences. So you have attended global surgery discussions at the pre-WHA in Geneva and also attended Oxford University's global surgery course. How were those experiences for you overall? And how did those opportunities change the way you view healthcare in Pakistan?
Um, so those are very interesting things. जब हम medical school में आते हैं, our parents and our elders, talked about us someday running a free hospital, free clinic, going into camps and stuff like that, right? तो हमारे mind में हमेशा ऐसा होता है कि हम कुछ करेंगे ऐसा. But I didn't know global surgery, what it is, that it exists. So global surgery essentially is a movement led by some of the top institutions in the world to make surgery accessible for everyone, right? So that includes surgical camps, that includes accessible care. हर चीज हम सुनते हैं, हम करना चाहते हैं, वो सब global surgery का part है. So when I actually heard about global surgery, I was like, Shajie, this is it. I mean, this is what you had been looking for such a long time, and it exists. And some of the leading institutions such as Harvard, Oxford, Cambridge, other Ivy League universities, WHO, and other global health bodies are leading this movement, right? So that's how I got into it. And Incision Pakistan, as you may know, Incision stands for the International Student Surgical Network. And I think around 50 countries are part of it. And it is the student and junior doctor led organization in global surgery. So we're dedicatedly working on global surgery, right? It's not just any random surgical society. So that Incision, I became part of it as the co-chair because Incision Pakistan was dormant for a long time. And Amna Zahir, who is a medical student at Liaquat, I think she just graduated. She revived it, and then I joined her, and we, sort of revived it together. And once I got into it, I got offered the opportunities within Incision, which were such as the WHO in Geneva. So Incision sends a delegation every year to WHO, and I was, alhamdulillah, lucky enough to be part of it. And then, of course, once you dive into the arena, you'd actually run into opportunities related to global surgery. So I got to know a lot of people, and that's how I came across the Oxford Global Surgery course as well. I applied for it and I got selected, alhamdulillah, and then I went for that. And I actually went for Oxford in the middle of my US trip. So I remember I was doing an observership in Texas where I actually matched in the first 2 weeks of September. And then I left for England. I went to Oxford and lived with my family for 3 weeks, and then I came back to the US. So, and I applied for the UK visa from within the US. That was another headache. But I made it happen from within the US, and I went to the Oxford course. I think they were just extraordinary experiences. The exposure that you have at these places is mind blowing. You never expect something like this to happen to you, and alhamdulillah, when it does, it exceeds your expectation. I mean, being at the United Nations in Geneva is surreal. Being at Oxford University, which is consistently the best university in the world for 10 consecutive years, is surreal, right? And I was very, very lucky to be there. And I'd just like to conclude with something. A lot of people, when they hear about these experiences that I went to these places, they might start thinking Shajie has achieved something in his life. And I think that's not the right way to look at it. I think हर चीज अल्लाह की तरफ से और US Assembly journey भी, I think it's very important to realize that 70 to 80% of the US Assembly journey is privilege, right? If you can afford to pay 40 to 50 lakh rupees for something, you're automatically in the top 2 or 4% of Pakistan's population, right? So the fact that it happened for you, that you can actually think about pursuing the US Assembly pathway, you're actually way ahead of 70 to 80% of medical students in Pakistan. And you had nothing to do with it, right? You had the parents with the support that you needed. You had a roof over your head, and your parents actually earned that much, and they helped you pursue this pathway, right? So please humble yourself. ठीक है, जब आप मैच हो जाते हैं, I hear everyone talking about how hard they worked and how much sleepless nights they went through. I mean, everyone goes through them. सिर्फ मैच लोग नहीं होते, ठीक है? There's so many more hardworking people in Pakistan, around the world, who are more hardworking than you, but who could never afford to pursue the US Assembly path. So just ground yourself, be grateful that you actually could afford the experiences, and once you go to the experience, make sure that you do what was expected from you. आपको ये privilege दिया गया है, इसका आपसे सवाल होगा, right? आपको क्यों दिया गया, बाकी लोगों को क्यों नहीं दिया गया? आपके पास इसका कोई जवाब नहीं होगा. The only thing is luck. और आप करना ये है कि इस एक्सपीरियंस को यूज करके you need to give back to community. That is the entire test. It is not an achievement. It is just privilege and it's a test. So अब मेरे पास burden ज़्यादा है to deliver because I've had these experiences, I've had this privilege. So now I need to do more in global surgery. जो मेरा eventual life में goal है, it's not just to become a surgeon, it's to become a global surgeon, to go to remote areas, make surgery accessible. अब मेरे पास ज़्यादा burden है because I've had the exposure जो दुनिया के best institutions देते हैं, right? So it's a responsibility that weighs heavy on my shoulders, and I want to deliver on it. And it makes me more stressful. Alhamdulillah, I was chosen to do it. तो इसी तरह मैच अगर आप हो गए तो इसी तरह सोचें, और इंशाल्लाह जब आपको भी कोई अचीवमेंट मिलेगी तो इसी तरह सोचिएगा how you can give back on what you got. I think that is a very, very important addition to the mindset that you can make.
Yeah, I definitely think that with passion, humility is extremely important, especially in our field. And this leads to like my next question, which is, what advice would you give students who are hoping to access similar international academic and advocacy spaces?
I think just get connected to the right people. Like I said, take that initiative. Societies join करें, surgical societies, organizations join करें. Incision को join करना कोई मुश्किल काम नहीं है. Incision Pakistan को join करना मुश्किल काम नहीं है. But when opportunities actually come to you, make sure you utilize them. 90% of the people don't, and they regret it later on. So just you apply the opportunities that you're getting, and if you're not getting any, create your own. वही बात है सारा, हर चीज उसी पे आती है, mindset आपका क्या है. I think that's very important. Baki, inshallah, once you get connected to the right people, you will get more and more opportunities, or things will start happening naturally, and you'll just, start getting more and more out of it. Inshallah, in a few years' time, you won't even expect to be where you are. So I think it's very important to be consistent and look out for opportunities and actually utilize those opportunities. हर जगह है, हमारे इर्द-गिर्द है, social media है. You just need to look for that. That's very important.
Right. That makes a lot of sense. Now, I think we'd love to move forward towards US clinical electives, which is arguably a really important part of the match process. Could you talk about your experience with USCEs, like where you went, how you found the process, and how was the overall experience there?
Hi, so I had 4 observerships in total. I couldn't do electives because I didn't have, I got my visa rejected when I was in final year. So I applied again in a year's time, and बीच में मैं UK pathway पे चला गया था. That's another story. I came back to the US pathway, and I did 4 observerships in total. The first one was at the University of Michigan in the section of pediatric surgery. The second one was at William Beaumont University Hospital in Michigan in pediatric surgery again. The third was at Vanderbilt University, again pediatric surgery. And the last one was at UT Southwestern Parkland, where I'm at in trauma surgery. So these 4 rotations, happened. And I think the experience overall was okay because, they were amazing places, but observerships, unfortunately, do not really let you do a lot. You can't do hands-on, and you spend a lot of time, and you feel like you're not getting what you need out of it. But that is okay. I think you just need to make sure that you're giving it your all. You're being engaged. You're asking questions. You're taking the opportunities that you do have, and you're just making the most out of it. And every center, every hospital differs in the sort of observership experience they give you. Electives are very different altogether. So if you're a final year medical student, if you're starting out final year, or even if you're in 4th year, start planning as to how you will pursue electives in the US. It's very important to start planning at least a year early, because applications open 6 to 8 months prior, sometimes 4 to 5 months prior, and you need to apply in time. और आपका एक plan होना चाहिए कि इन जगहों पे apply करूँगा या करूँगी. And for that, VSLO is a very good platform. We have other university hospital websites that take electives. And we have agencies, which are sort of the last resort, but if you're not getting any other elective, then maybe agencies can be tried as well. And then observerships. Okay, so observerships are not really ideal. But unfortunately, as IMGs, most of us are able to do observerships only. And that is why, like I said, it's very important to do rotations at IMG friendly programs. तो चाहे वो कम्युनिटी प्रोग्राम हो या यूनिवर्सिटी प्रोग्राम हो, आप शुरू से वो एम रखें कि रोटेशन वहाँ लेनी है. जैसे मैंने बोला, रिसर्च के जो कनेक्शंस बनाएं, build connections at those places ताकि eventually you can request them for observership and you go there and you make a connection and you're able to get an interview out of it. Do these rotations as close to the mass cycle as possible. Electives तो ज़ाहिर है you're restricted, या आप medical student होते भी कर सकते हैं. और ideally you should apply for the match right out of medical school, right? तो इसी तरह electives भी बहुत ideal timeline में call करते हैं. You just give your final year exams, you do the two to three electives and then you apply for the match. लेकिन अगर अगले साल करें फॉर एग्जांपल तो इलेक्टिव करें, एक या दो कर सकते हैं तो करें, और फिर अगले साल एक या दो ऑब्जर्वेशंस कर लीजिएगा बिफोर द मैथ साइकिल. But it's important to have at least 3 rotations in the back, and the more electives the better. But if you're not able to do electives, it's okay because they're costly anyway and they're not possible for most people to do observerships and aim for observerships at IMG friendly programs. I think that is the key.
Right. So I think this is really important insight into clinical electives and observerships. You mentioned about meaningful connections before. So I'm going to draw my question out of that. And how can students make meaningful connections during rotations while also learning as much as possible? Because I imagine there's a lot going on when you're rotating.
So when you're rotating, you're mostly spending time with residents because they're attending to 24/7 available nahi hote. They come in for surgeries, they come in for rounds, and that's it. So if you're able to impress the resident and they're nice people, I mean, I think that is upon your luck, then they may be able to recommend you to the attending, put in some nice words for you. So the goal is to connect with that attending, right? So आपका जो भी preceptor है, जो भी supervisor है, के साथ अच्छा connection बनाना है, तो rotation में अच्छा perform करना है ताकि resident recognize you. And then of course, once you have face time with the attending themselves in the OR or during rounds, try yourself to be as engaged as possible. Rounds में, जैसे for example, there was at Beaumont Hospital, I could present one patient with the help of the resident. तो मैंने एक patient present किया हर round में. And that is something you can maybe try to do. Not everywhere, but not every place will allow you to do it. लेकिन अगर present नहीं भी कर पा रहे तो ask good questions about the case जो interesting है या कोई patient है जो critical है, अच्छे सवाल prepare करें. Be engaged with the attending. Be engaged in management discussions कि patient किस तरह manage कर रहे हैं, give your ideas, ask questions. And then in the OR, I think it's also very important to stay engaged throughout. Sometimes people, get distracted or bored because surgery लंबी होती है, but I don't think you can afford to do that. Stay engaged with the surgery even if you're bored. Keep looking at that screen and, कोई चीज समझ नहीं आ रही उसी वक्त सवाल पूछे attending से if they are willing to answer questions. लेकिन मैं जैसे करता था, I used to prepare at least a couple of questions about every procedure. And when the surgery ended, the attending scrubbed out. So I used to ask those questions, of course, after requesting them for a couple minutes of their time. So that really helps in, making an impression. And just revise your basics. So I think, for example, if a hernia repair ho raha hai, so it's very important to revise some of the anatomy of inguinal hernia or whatever hernia is being operated on. And some very basic questions about how the procedure goes. Your attending can ask you, and if you're not able to answer a very basic question, then that gives a bad impression. So prepare for the case and stay engaged as much as possible. And of course, one other way of making amazing connections during these rotations is research itself. So I mean, you're actually face to face with an attending instead of emailing them from 1,000 miles away, right? तो इससे बेहतर opportunity क्या है? ठीक है, तो project उनके पास लेके जाएं और उससे collaboration वापस लेके आएं. ठीक है, तो I think that is also very important. You have to long-term connection build करना है. अगर आपने वो publication pull off कर ली तो फिर you have a mentor for life.
Right. Okay, that is really interesting insight. And now I would move on to a question that I personally have had for a very, very long time, and a lot of other students also ponder upon it. Are there any mistakes that students should completely avoid during USCs?
Hmm. I think mistake. It's funny because when I think about mistakes, I think about things that you actually couldn't avoid. तो मिस्टेक तो ज़ाहिर है होती है गलतियां राइट तो वो सबसे हो जाती हैं एवरीवन विल मेक देयर ओन सेट ऑफ मिस्टेक्स एंड दैट इज ओके आई थिंक उस तरह से माइंडसेट आपको सही रखना है कि अगर आपसे गलती हो गई तो own it and apologize for it and make up for it. So even as an observer, if you're, for example, I was asked this question during a surgery at UT Southwestern, और मुझे उसका आंसर नहीं पता था. It was about the critical view of safety in cholecystectomy. ठीक है तो वो मुझे याद नहीं आ रहा था उसको I knew it मुझे याद नहीं आ रहा था तो I revised it immediately and then I went to him myself. I was like, this is what it is, right? And he was happy with it. ठीक है so I think they don't expect you to know everything. They just judge what sort of person you are. अगर आपको कोई चीज नहीं आती बोलने नहीं आती and then prepare for it and get back to them. If you make a mistake, apologize for it, own it. And उसके अलावा आई डोंट थिंक ऐसी कोई मिस्टेक आप कर सकते हैं ऑब्जर्वरशिप में लेक्चर्स में यस हो सकती है हैंड्स ऑन चीजें करते हुए बट देन अगेन they don't expect you to be perfect so just make sure you practice beforehand for example suturing की practice आप करके जाएं अगर elective पे जा रहे हैं बेसिक चीजों की practice करके जाएं और just be engaged as much as possible and have that sort of teachable attitude. Teachability ना बहुत important होती है हम इसको सोचते नहीं हैं अटेंडेंस लुक फॉर पीपल हु आर टीचेबल जो अगर आपको कोई चीज सिखाई जा रही हो तो आप किस माइंडसेट से सुन रहे हैं और आपको किस तरह इंटीग्रेट कर रहे हैं इनटू योर प्रैक्टिस तो अगर मुझे कोई चीज वो समझा रहा है अटेंडिंग ऑफ कोर्स दे टेकिंग आउट टाइम आउट ऑफ द वैल्यूएबल स्केड्यूल टू टीच मी समथिंग और मैं उसको नहीं शो कर पा रहा कि मैंने इसको इंकॉर्पोरेट किया है इनटू हाउ आई डू थिंग्स एंड हाउ आई वर्क so that's useless and that is not a good thing या फिर मैं अकड़ जाऊं या फिर मैं एरोगेंट हो जाऊं मैं अपोलोजाइज ना करूं मैं गलती को ओन ना करूं आई थिंक दैट इज अ वेरी वेरी टॉक्सिक ट्रेट तो अगर इनमें से एक झलक भी उनको मिल गई ना आपकी तरफ से तो दे विल नॉट कंसिडर यू टीचेबल एंड दैट विल मेक अ वेरी बैड इंप्रेशन जस्ट बी हम्बल अगर आपने गलती नहीं भी की और दे से कि आपने कुछ किया है तो आई एम सॉरी आई हैड नो इंटेंशन ऑफ डूइंग दिस how can I, fix my mistake? How can I improve? How can I do better? Just have that positive mindset. How to do better? How to keep improving? That matters a lot.
Right. Yeah, I definitely think being open to learning and being humble about all of this is really important. And with that, that was my last question. I will be handing this back to Hamayel.
Thank you so much, Abia. So now let's move on to the next part of the podcast, which talks about the mindset challenges and general reflection of the whole pathway. So the first question I would like to ask you is that what was the hardest part of your journey, both emotionally and mentally? And how did you deal with stress, uncertainty, and setbacks during such a long process?
Wow. So like I said, I was in the US for 6 months. That is a very, very long time to spend alone in a strange place, in different cities or different institutions, with different kinds of people. So I don't really have, one set of advice that will work for you. But honestly, stick to your support system. It's very important to have that sort of support system in your life. Stay in touch with your friends, with your family constantly. And वही बात है कि when you have the right motivation, you can actually get through it. You just need to believe it. So, for example, when I went, मैं last year के May के end में गया था. मैं पहले Geneva गया. I came back to Pakistan, and then 2 days later I flew to the US. And I was going for 6 months. So that was I was very stressed and I was very scared. But I also had to take my step 2 during my observerships. And I had to apply that cycle. And I had to do 3 observerships in total. I had to go to 2 conferences. I had to apply for the UK visa for Oxford. There's just so much going on. Right. So I remember I was, I was with my wife before leaving, and I was crying constantly. And I was inconsolable because it was so hard to accept कि ये कैसी होगी journey. It was such an overwhelming feeling. But Alhamdulillah, once I got there, things started happening. June was a very hard month because the observership itself was, even though it was very good, but it was very hectic. So I had to prepare for step 2 और मैं सुबह 5 बजे उठ के जाता था 6 बजे I had to reach at the hospital और मैं वापस शाम 6-7 बजे आता था. So I had no energy to study, लेकिन I had to study because I had my step 2 in the first 2 weeks of August. Right? And I had to take, get that 250 plus score as well. So a lot of expectations. For July, alhamdulillah, things happen. Things get easy. You just need to persevere. July major observership day, it was relatively much chiller at Vanderbilt University. So I had extra time to make up for what I couldn't do in June. And then I took my step 2 in August. So, and uske baad फिर I got used to it. I was like, hey, ho jayega sab inshallah. So I think just faith in Allah and yourself and having that support system and planning appropriately अपनी trips को ऐसे plan करें कि वो workable हो, flexible हो, आप कर सकें. end moment पे overwhelm हो रहे हैं कि this doesn't work out, that didn't work out. पहले से planning करके जाएं, that is very important. And inshallah you will get through.
That's honestly really inspiring to hear. And I definitely agree with you that in difficult times like these, a good support system, faith, and solid plans are definitely what gets us through. And this kind of brings us to the last question, and that would be that if you had to tell something to your younger self back in first year of medical school, what do you think that would be? And if students remember only one piece of advice from today's podcast session, what do you think it should be?
What I would tell myself and what I would advise my juniors are two different things. What I would tell myself is that, Shajie, everything will be okay. Because there are so many uncertainties in life, and if you start thinking like that, कि अब क्या होगा, ऐसे कैसे होगा, वो कैसे होगा, then you're just falling into a trap. Because as a Muslim, I personally believe it's a very negative mindset to have, and it's actually not good to have. Because you need to have faith in Allah and His capabilities, and things will happen for your betterment, right? अगर आप उस पे ईमान लाते हैं, उस पे यकीन रखते हैं, तो things will happen better for you. What I would advise to my juniors is, because I didn't have to advise that to myself, मैं हमेशा से ऐसी था, but juniors को मैं ये बोलूँगा, one line, accept this, take responsibility of your own journey. ठीक है, आपकी जिम्मेदारी है, आपका रास्ता है, आपकी जिंदगी है. आप बैठे रहें, लोग आपके लिए चीजें करते रहें, आपके लिए अपॉर्चुनिटीज ला के दें, आपको ऑब्जर्वरशिप ला के दें. फाइनल ईयर में आप लोग, आई डोंट नो फाइनल ईयर में है या नहीं है, एट व्हाट स्टेज ऑफ द जर्नी यू आर इन, लेकिन आप देखेंगे फाइनल ईयर के बाद जब ऑब्जर्वरशिप का टाइम आता है तो हर जगह पूछा जा रहा होगा कि मुझे ऑब्जर्वरशिप करा दो, मुझे कहीं से ऑब्जर्वरशिप करा दो, मुझे कुछ नहीं मिल रहा. यू आर कम्पीटिंग फॉर द मोस्ट कम्पिटिटिव pathway in the world. Right? How can you not be prepared? I mean, that is, unless you decided to pursue the US Assembly pathway in the last 6 months or 1 year, you never knew that you had to, pursue it. तो चलो समझ आता है, you didn't have time. लेकिन आपने first, second year, third year से सोचा है कि आपको MLE करना है, and you didn't prepare for it. How is that logical? Right? Hold yourself accountable. आपको अपनी जर्नी खुद लेके चलनी है, आप जिम्मेदार हैं अपनी चीजों के बारे में. सो स्टार्ट मेकिंग थिंग्स हैपन फॉर योरसेल्फ. पूरे वेबिनार में मैंने यही चीज बोली, माइंडसेट की बात है, चेंज करें, अपने हाथ में चीजें लें, इनिशिएटिव खुद लें, अपॉर्चुनिटीज खुद क्रिएट करें. आई एम ऑलवेज देयर फॉर माय जूनियर्स. मुझे पता नहीं कहाँ से मैसेजेस आ जाते हैं, और दूसरे दिन मैं किसी को जानता भी नहीं होता, लेकिन आई एम ऑलवेज देयर, बिकॉज ये ज़ाहिर टेक्निकल चीजें होती हैं, मुश्किल होता है, ओवरवेलमिंग होता है, मेरे लिए भी था. इट वाज वेरी स्कैरी लॉट ऑफ ओकेजन्स, लेकिन करना है तो करना है. अगर सर्जरी मैच होना है तो करना पड़ेगा, ठीक है. अगर सक्सीड होना है तो करना पड़ेगा. इवन अगर मेडिसिन में भी जा रहे हैं, इंटरनल मेडिसिन, द यूएस इज नॉट अ पीस ऑफ केक, इट्स वेरी हार्ड स्पेशलिटी टू मैच इट टू. नाउ ठीक है, पिछले 2-3 सालों में बहुत ज्यादा कॉम्पिटिटिव हो गई, तो हाउ कैन यू नॉट बी प्रिपेयर्ड फॉर इट? सो यू स्टार्ट वर्किंग राइट नाउ. यू नो व्हाट यू हैव टू डू. रिसर्च पे काम करना है, कनेक्शंस पे काम करना है, स्टेप 2 स्कोर अच्छा लाना है. इन 3 चीजों को प्रायोरिटी बनाएं, बाकी अपनी पर्सनालिटी बिल्ड करते रहें, एक्सप्लोर योरसेल्फ, volunteer in organizations, do things in medical school, make friends, have a good time, because this time won't come back. You have no idea how much we all miss medical school. Even though it sucked when we were there, हमेशा ऐसे ही लगता था कि पता नहीं कहाँ आ गए हैं, कैसे ऐसा क्यों हो रहा है. लेकिन अल्हम्दुलिल्लाह मैंने कभी ऐसा नहीं सोचा. I knew where I was at and I was very, very grateful for it. So, just start appreciating where you are, and inshallah, you will then start appreciating where you want to be, and then you will get it. You'll get there.
That makes a lot of sense. Thank you so much for answering the question. And that kind of brings us to the end of the podcast episode. Thank you so much, Dr. Shajie, for joining our podcast today. Your journey is honestly truly inspiring, and hearing about it has taught us all a lot. And we look up to you immensely, and we really appreciate you helping so many juniors like us along your way. And we hope to follow your footsteps and hopefully continue the forward your legacy here at SoMR. And thank you again for taking out the time to be here with us today.
Well, thank you so much for having me, and I think this was a very, very good discussion to have. And I hope that the audience will benefit from it. And like I said, if anyone wants to reach out, they can always reach out via email or WhatsApp or whatever works for you. So you are free to share my contact information if anyone asks for it.
Sure, I'll make sure to definitely share it. Thank you so much.
My pleasure. Take care, guys.
Take care.